Okay, we're continuing now with the book. This is part 22, Prevent and Reverse Kidney Disease by me, Pete Rogers. We're on chapter 6. It's on page 132 if you're following along in the book. We're going to talk about diabetes. Diabetes is the most common cause of kidney failure. So it's very common for patients on dialysis to have diabetes and hypertension. Okay, the key thing to know about diabetes is that conventional wisdom, as usual, so-called wisdom, conventional medicine, it's wrong. It's stupid, okay? They're going to tell you that diabetes is a sugar disease and you should count your carbs. I agree with Dr. McDougall. He says, no, count your fats. It's a fat disease. It's a fat metabolism disease. It's not a carbohydrate disease. That's just a secondary manifestation, elevated blood glucose. Okay, that's a symptom of a problem with fat metabolism. You first accumulate fat in the skeletal muscle. That's called intramyocellular lipid. They tested that with nuclear magnetic resonance spectroscopy. Gerald Shulman won the Banting Award 2018 for confirming that. And that gives you postprandial, high blood glucose after eating because you've accumulated fat in your skeletal muscle. It gets there from eating high-fat diets. The second thing is you accumulate fat in your liver from eating diets high in fat, also from being an alcoholic, also from eating a lot of high fructose corn syrup. Fat accumulation in the liver is called fatty liver. The main job of the liver is to regulate your blood glucose level, to maintain glucose for your brain in the blood while you're fasting. So once you accumulate fat in the liver can no longer properly measure blood glucose level, and it keeps pushing glucose into the blood. And that keep on pushing glucose into the blood will, give you fasting hyperglycemia. So initially it's just postprandial hyperglycemia, meaning after eating, but then it becomes around the clock fasting hyperglycemia as well. Then fat starts to accumulate in the pancreas and contributes to destroying the beta cells of the pancreas islet that make insulin, and then the patient's kind of screwed. It becomes irreversible at that point when you no longer can make insulin. So that's why you want to try to reverse this disease. The sooner the better, while you still have the ability to make insulin from your pancreas. Okay, so this is type 2 diabetes we're talking about. Type 2 diabetes is way more common, like 90% of diabetes is type 2 diabetes. It used to be called adult onset, but it's happening in younger and younger people. People are eating worse and worse diets. Okay, I'm going to show you a little bit about the mechanism here. Let me scroll down to the pictures, because what I'm really doing with these videos is narrating the pictures primarily. So here it is. Saturated fat in particular, more so than the other fats. The other fats will contribute to insulin resistance, but sat fat's the worst of them. It'll inhibit intermitochondrial membrane electron transport. Okay, and then once electron transport backs up, then everything backs up. Krebs cycle backs up, glycolysis backs up. Okay, and in a sense, the cell is overwhelmed, especially sat fat, because it's more reduced than, let's say, a PUFA, polyunsaturated fatty acid. And what that means is you're going to generate more electron carriers when you break down the sat fat through beta oxidation than you would with a PUFA, polyunsaturated fatty acid, one that has double bonds in it. And that's going to lead to more electrons being more rapidly sent to the intermitochondrial membrane. It becomes overwhelmed by them. And when the gradient goes too high for pumping the protons into the intramembranous space, the proton gradient that is, then it can no longer pump protons in and it starts reversing. And then you start dropping electrons down in the matrix. They combine with oxygen, produce superoxides, free radicals. Okay, so that's all bad. The bottom line is bad. Okay, then you next ask yourself, well, why do things get messed up? First of all, let's take a look at normal insulin function. Normal insulin, your blood gets glucose into it, and then it comes up through your portal vein. Your pancreas, your liver sense it. The insulin released from the pancreas is increased to compensate for the elevated blood glucose level. It travels to the skeletal muscle. Most of your glucose after eating, postprandial, should go into your skeletal muscle to be made into glycogen. And when insulin binds to the receptor on the plasma membrane of skeletal muscle, it sends glucose type 4 transporters from the cytoplasm up to the plasma membrane. They merge with the plasma membrane and they create channels to allow glucose to come into the cell. And that's how a skeletal muscle takes up glucose. That's the normal situation. But when you've got the phenomenon of overnutrition due to excessive fat in the mitochondria, then the cell is overwhelmed. It becomes what is called overnutrition. And when you have an overnutrition situation, the mitochondria sends a signal to block the glucose type 4 transporter so they don't go to the muscle. And then when the glucose 4 transporters, they don't go to the plasma membrane. When they don't go to the plasma membrane, you can't get glucose into the cell. So glucose accumulates in the blood. So you get this after eating, postprandial hyperglycemia. That's how it happens. Okay, so what's the answer to that? Don't eat so much fat, and then you won't get this effect. That's what you need to know. Populations where they don't eat a lot of fat, they don't get type 2 diabetes. Okay, so here's a curve of blood glucose level over time. If you only eat starch, blood glucose comes up a little bit. That's normal. It's supposed to come up after you eat, but not that much, and it stays close to right in the normal zone a prolonged amount of time. If you eat fat first, followed by the carbohydrates, then the fat causes insulin resistance, and then you get a prolonged postprandial hyperglycemia. So the fat caused insulin resistance. The fat caused what is called decreased carbohydrate tolerance. Okay, so then the next mechanism is, well, what else could I do? Well, let me just tell you something. This is an interesting paper. I think the guy's name was Jay Hamilton. In my other papers, I give the references for all this stuff. I've given tons of talks on this stuff. So you can't, however much fat you have, you'll get a proportional amount going into the cell cytoplasm, because the skeletal muscle plasma membrane, it can't keep the fat out. The fatty acid comes up to the plasma membrane, outer leaflet. It gets protonated, so it gets a hydrogen proton, and then it intercalates itself into the outer leaflet, the outer face of the phospholipid bilayer. And then it'll flip-flop from the outer layer to the inner layer, and then it'll move into the cytoplasm. So it's sort of a bulk flow movement depending on the concentration of fat in the blood, subsequently in the extracellular space. So the only thing you can do is eat less fat. That's the only way to win this game. You know, some people genetically are lucky, they're more able to rapidly metabolize it. But in general, if you want to improve your odds of winning the game, not getting diabetes or controlling your own diabetes if you already have it, stop eating so much fat. Minimize your dietary fat intake. That's what you need to do. And this is the reason why I'm telling you, you're not going to win the game any other way. You know, you can try exercising more, sure, but why not do the obvious thing, eat less fat? And why not cure yourself fast? Why take pills the rest of your life trying to control it and watching yourself deteriorate when you can just eat less fat and cure yourself? This has been known for a long time. Kempner was cured virtually all of his type 2 diabetic patients, you know, and Pritikin was curing them left and right. Same with McDougall, same with anybody who's put them on a low-fat diet. Other researchers, you know, found essentially the same thing. The J. Shirley Sweeney study in 1927, Rabinowitz papers, Hemsworth papers, etc. Okay. So the role of fatty acid, the rate of fatty acid entry into the skeletal muscle cells was just dependent on the concentration of fatty acid outside the cell. And the best way to reduce that concentration of fat outside the cell is eat a low-fat diet, eat less fat. Okay? There's no way around that. Okay, Michael Brownlee wrote the fantastic, best paper ever written on diabetes called The Pathobiology of Diabetes Complications, a Unifying Mechanism, published in the Diabetes Journal in June of 2005. And he won the Banting Award as the best diabetes researcher in the world in 2004. That's Michael Brownlee. He's a guy who had type 1 diabetes, and he was told he was going to die in his 30s. And he decided he'd try to live longer than that, so he devoted his whole life to researching diabetes. And the guy was a genius. He figured out the whole inhibition of intermitochondrial membrane electron transport mechanism. That paper, it's like the Sistine Chapel of medical papers, of diabetes papers. When I first read that paper, I was like crying. It was so beautiful. It was just over the top beautiful. Okay. And you know what? I think we'll leave it at that. That's a pretty big thing to know. If you know that that's what causes diabetes and you can avoid that, eat a low-fat diet, and that's how you can cure type 2 diabetes, that's valuable information. That's like about as valuable a piece of information as you can get. So we'll call it a day at that point, and we'll return with this other stuff for next time.